All right, so we are live. We'll give it a couple minutes or a couple seconds here to let some folks join us before we get going. All right, wonderful. So we'll go ahead and get started here. My name is Chelsea. I'm going to be your host for our Facebook Live today on COVID-19 vaccine updates in the state of Wisconsin. I'm joined here by Andy Wheaton, our manager of pharmacy benefits. And he's going to give us some COVID-19 vaccine updates. So just a couple of housekeeping notes. If you have any questions at all during this Facebook Live, please go ahead and drop them in the comments section and we will answer them as towards the end. And then we also have Kelly in the chat. She is also with Network Health and she's going to be sharing any relevant links that we discuss and any sort of useful links there for you. For those of you who have tuned in, you already know who Andy is. You already know why he is our expert. But for anyone new joining us, Andy, can you tell us why you are our COVID-19 vaccine expert?
Yeah, Chelsea, thanks for having me again. So again, my name is Andy Wheaton. I'm a pharmacist, manager of the pharmacy department here at Network Health. This past fall, I co-led our Medicare flu vaccine clinics that were COVID friendly. And now I'm coming to you to provide some updates on the COVID vaccines and the rollout throughout the state of Wisconsin.
Wonderful. So we can go ahead and kind of roll into some of our questions. You know, we had a new phase of eligibility that began last week. Can you give us a bit of a recap on that and then where and how folks are able to get the vaccine now?
Yeah, so beginning on April 5th, so Monday, April 5th, all individuals age 16 and older are now eligible for COVID-19 vaccinations in the state of Wisconsin. So if we remember back before then, you had to have some comorbid condition in order to qualify for the vaccine. That has all been removed, and now anybody 16 and older can now get the vaccine if you wish. Where to get it? So I truly encourage people to go to our Network Health website. We have links to an interactive map through the Wisconsin Department of Health Services. And that basically you can click on your particular area, your geographic location within the state, and then it actually directs you to actually vaccine clinics or pharmacies that are available that are providing vaccines. So I continue to get phone calls and text messages from family, friends, and coworkers on where can I get the vaccine. So I direct them there. As just from what I've been able to gather, most of the clinic openings, you know, the slots that they open up for the vaccine timeframes, those become available on Saturdays and Sundays typically. So make sure you're checking back if you see that the particular clinic you wish to get your vaccine at maybe is closed for that particular time frame. Just keep checking back, and most likely on Saturday and Sunday that'll open up, and then you can register for that. As a reminder, just want to make sure everybody's aware you don't have to bring your insurance card or any other documentation. You can't be turned away. Some providers will take that and they'll bill for the administration fee, which there should be no charge to you. Just want to make sure everybody's aware of that. And we're also hearing that some clinics are actually taking walk-in appointments, which is great. We're just opening up and providing that availability to people throughout the state of Wisconsin. The biggest one is the Wisconsin Center in Milwaukee. They're offering those walk-in clinics. So take advantage if you're in that area.
Absolutely, yeah. And that map is such a great resource. I know I used it, and you can kind of zoom in and out and kind of check around your area. So if one pharmacy is closed or doesn't have any appointments, you can kind of go back and move on to the next one and check that out too. So it really is a fantastic resource. So for the next question, I think it's a question that a lot of people have is, can you expand on the Johnson & Johnson vaccine news and kind of tell us a little bit more about what is going on right now?
Yeah, so we started hearing some of this information late Monday into Tuesday morning. So on Tuesday morning, the FDA and the CDC recommended holding any further Johnson & Johnson vaccinations until they looked at the information a little bit further. So the concern that's being raised is there's an ultra rare, I'll call it ultra rare, blood clot disorder that they found in 6 cases. Now this is out of more than 6.8 million doses that have been provided. So again, extremely rare, and it's being done out of an abundance of caution. The advisory committee that makes the recommendations to the FDA, they're actually meeting as we speak. So this afternoon they're meeting. They're going to go through the information, the cases that are being presented, and all the information around that, and just trying to decide, do they have to make updated recommendations? Do they stop the Johnson & Johnson vaccine altogether, or do they they say, yep, we acknowledge that this is happening, but we feel that the risks are not as high, so we're going to continue as is. So more to come on that. They're meeting, like as I said, they're meeting as we speak. So we should know more later today into tomorrow, and we'll provide those updates on our website as well as during our Facebook Live conversation next week.
Absolutely.
So
yeah.
Just an update on who these people are and just kind of the demographics that we're looking at. So all 6 of these cases were in women between 18 to 48 years of age. Symptoms occurred between 6 to 13 days after the vaccination. And it's the clot type is a cerebral venous sinus thrombosis. Now this is in a vein that drains blood from your brain. And it's in combination with low levels of blood platelets. So researchers are still trying to determine, what's actually going on. The initial thought is that it's the viral vector itself. So the Johnson & Johnson vaccine, as we remember, is a viral vector vaccine. So what that means is we use an adenovirus, which is a cold virus, and it's been modified to deliver the spike protein DNA. So they think it's possibly related to that viral vector, but again, more to come on this one. Again, very extremely rare. So we're talking less than 1 in a million chances. For those of you that have received the Johnson & Johnson vaccine, what I would just recommend is not to be alarmed. But if you have had, if you notice any of the potential side effects, so we think of severe headaches, abdominal pain, leg pain, shortness of breath within that 3 weeks of vaccination, that's when you probably want to give your doctor a call and just check in, just see if that's a concern. Again, I just want to remind everybody, and I don't want to make light of this issue, but it is extremely rare. Just in comparison to a person a female that's on hormonal birth control, that's typically a 1 to 5 in 10,000 chance of getting a blood clot, where this is 1 in a million. So again, very extremely rare, but we want to take a look at the data, see if there's any updated recommendations that we need to provide for future use on the J&J vaccine.
Absolutely. So next question that kind of leads off of this one. So with J&J being paused, what is the vaccine availability like in the state of Wisconsin? Is this going to affect the number of doses we have for people who are either currently have appointments or looking to get appointments for vaccines?
Yeah, so we started hearing that as soon as the FDA and the CDC made this recommendation, everybody started to hold the appointments for the J&J vaccines or cancel them just initially until we get further information. So with the pause in the J&J vaccine from this kind of situation, we also saw that from a production standpoint, they were also having some challenges in the U.S. So they were gonna have some concerns with quantities, availability beyond that as well. So from what we're hearing from the Wisconsin DHS, there shouldn't be an issue with supply. We understand that there's going to be a small dip in the J&J vaccine with that concern, but what we're being told is Moderna and Pfizer are increasing their supplies, and DHS feels that we should be good going forward. So more to come on that, but that's what we have at this point.
Good news. Good news. We do have a question that I would love to get to right now because I feel like it ties in well with what we're talking about. So the question is, when I sign up for a vaccine, am I able to select which type I receive? And I know we had a question, or we had kind of a answer around that previously, but is there any kind of different answer currently?
Yeah, so the pharmacies aren't able to select which vaccines they're getting in stock. So my recommendation is going to continue to be get whatever one is available. Don't be choosy on it. They're all extremely effective. They're all highly effective against serious disease, hospitalization, and even death. So no matter which one you get, you're going to be covered. From a selection standpoint, like I said, I wouldn't be choosy. Just get whichever one you can get.
Absolutely. Yeah, great. So kind of our next question that we have on here is, we have kind of seen cases rising and concern about another wave coming. Can you tell us a little bit about that and what you're seeing there?
Yeah, so this is going to continue to be a concern as nicer weather is upon us in the state of Wisconsin. Everybody's looking to get outside, and you start to hang out with your friends and family. So throughout the country, there's a concern of another COVID-19 infection wave, with people being a little bit more relaxed with their precautions. So that's one of the big reasons that you saw the state open up their eligibility a little bit sooner than we would originally thought. We want to get vaccines in everybody's arms as quickly as possible to dampen down the chances of a fourth wave or third or fourth wave, however you want to look at it, going forward. So I want to make sure that everybody's aware, even if you're vaccinated, continue to take those precautions, wear your mask, socially distance when appropriate, make sure you're hand washing. In the event that you're fully vaccinated, so that means 14 days after the second dose, the CDC has actually updated some of their guidelines and said, we understand that we can lift some of the restrictions for this particular population. So we start to think about, you can start to gather with other people that have been fully vaccinated. You can gather with one other household for unvaccinated families or people. We're still waiting on some of the restrictions on congregating in larger groups. So CDC has kind of been telling us that they're going to look at that in the near future and provide some of those updates. We're very interested in that, obviously from a workforce standpoint, as well as gathering with family and friends, which is something we're all looking forward to doing in the near future again, right?
Absolutely, yeah. You kind of touched on it. We have another question here that I think relates really well is, when I get a vaccine shot, do I have immunity right away, or does it increase right away? So I've heard folks say, I've gotten the first shot, I've got 50%, how does that work? And you mentioned that 14 days after your final shot, so after your second shot, you're fully vaccinated. But kind of how does that immunity work once you've gotten each shot?
Yeah, so once you get that first shot, so say you get the Moderna shot, you're going to wait about 28 days in between doses. So your body starts to mount that reaction. It starts to create the spike protein, and then your body's immune system creates a response against that spike protein, and that's how it recognizes the coronavirus if you would come in contact with it. So your body starts to mount that response. You don't get as high of a response. So when we look at the effectiveness of the Moderna shot, you say 94, 95%, you're in probably the 60, 70%, maybe a little bit more. And then you need a booster shot just to kind of re-jumpstart your immune system to create that additional efficacy to get to that 94 or 95% mark. And then after that second shot, it takes about 14 days to mount that additional reaction. And that's when we're fully vaccinated and we get to that effectiveness that we all are looking for.
Awesome. Great to know. Another question that we have come in, and feel free, if we've got anybody on here who has more questions, please send them our way. But question is, why do you think Michigan has such an increase in cases compared to other states?
Yeah, I think that's a great question. One thing and I'm not as up to date on their vaccination rates, but I think that that's probably a portion of that. In the state of Wisconsin, we started off a little slow with our vaccination rates and just trying to get that rollout going. But, over that first, I would say 3 to 4 weeks, once everything was kind of into circulation and going, we really vaccinated really well. And our pharmacies and clinics, everybody that's involved with that did an amazing job. And from if you look across the country, Wisconsin is by far one of the best. Other states aren't as lucky as us. We don't, for whatever reason. So you think of the vaccination rates. What are they doing from a precautionary standpoint? Are they following some of the guidelines? Are they masking? Are they doing the socially distancing that we do in the state of Wisconsin? I'm not as familiar with kind of their practices over there in Michigan. I understand that it is continuing to be a challenge. Recommend, again, just if they're able to, if they have vaccine supply, they need to continue to provide it. If you're living in the state of Michigan, make sure you get your vaccine, sign up for that, and get protected. And remember, you're not only protecting yourself, but you're protecting your family members and your friends and coworkers as well. So that would be my advice.
Absolutely. Yeah, a lot of factors at play, but ultimately sign up for that vaccine. Fantastic. I think kind of our final question here is, how do I convince a family or loved one that they should get the vaccine? Or how do I talk to someone who is hesitant to get the vaccine? What would your recommendations be for approaching that conversation?
Yeah. So this is the question that we commonly get, and as I'm speaking with family and friends as well, I'll get these questions quite a bit, actually. And I really stick to the facts. If we look at the rate of infection and the potential for serious disease and compare that to, say, the flu vaccine or the flu virus, you have a higher chance of being hospitalized or having some sort of severe infection, potentially even death, with coronavirus compared to your average flu. So that's probably the big thing. There's a lot of myths out there with, is the government doing some sort of tracking device? Am I going to get COVID from these vaccines? That is not the case. I want to make sure everybody's aware and reassure you that you can't get COVID from these vaccines. There's no tracking device in the vaccine. So just make sure to really talk about the facts about the vaccine and about the disease, and that's going to really encourage those that are kind of on the fence to get the vaccine. So really want to make sure everybody's aware of that and doing the right thing and making an educated decision.
Absolutely. Yeah. I think, looking at those trusted sources of information is really important. We all see all of the links on Facebook, that seem like they're very legit, but when it comes down to it, you really need to check your sources and make sure they're coming from trusted health sources.
Absolutely.
Yeah, fantastic. So I don't see any other questions in our chat box here, but if anyone does have any additional questions, feel free to reach out to us on our Facebook page, and we will do our best to answer them as quickly as possible for you guys. Again, if you have any other questions or want to find out where you can get a vaccine, head to networkhealth.com/coronavirus vaccine. Kelly did leave that link in the chat here as well for you. Thank you so much for joining us, Andy, and we will be back here next week to discuss all of the updates in the week to come.
Thank you.
Wonderful. Thank you. Bye.